You are welcome in Catania. The University of Catania, together the Residence Lab of the University of San Diego, welcome you all to this international One Health conference. We talk about the conference later. Now let me thanking the chief guests for being present and giving their valuable attention to this event. I will give them the floor for 5 minutes for greetings. So at first, I have the honor to talk for the University of Catania because the rector is out of Catania in Spain at this moment in Madrid. So the University of Catania is very proud to host this international conference and have sustained me in the organization at all. The next speaker will be the University Hospital of Catania, but the general director now is not present, unfortunately, so we are respecting the hospital director, sanitary director, Dr. Antonio Lazzara, but in the meantime we go on with the conference. And at first I have the great honor of having here online the director of the Department of Environment, Climate Change and Health of the WHO, Dr. Maria Neira. So in this very difficult time for the whole world, we are looking forward to your comments, Maria. Please, the floor is yours.
Thank you. Thank you very much, and a pleasure to be with you. Honestly, I will very much prefer to be physically in Catania for personal reasons and family reasons, very close to Sicily. So it will be for me a great pleasure to be there. But unfortunately, here I am from Geneva and still full of gratitude for the invitation, and as well congratulating you for this initiative, the University of Catania, all the associations that I don't want to nominate all of you, but a big recognition to your work, my friends working for the environment and linking the environmental health, human health, and animal health. Let me start with something positive. So, as you rightly said at the beginning, those are very sorry, I think you need to switch off one of the micros. That's okay. Okay, I was saying that at these very difficult and challenging times, our citizens are getting a little bit concerned about the apocalyptic news that they are hearing every single day. So let me try to put a positive agenda for a transformation. And it's an agenda that I'm convinced that the health professionals from universities, from the academic world, from the hospitals, from the environmental health groups, from anyone working for health and contributing for health has to endorse this agenda of transformation. They are critically three transitions that we need to influence, we need to push for it, we need to provide the scientific evidence for it, and we need to make sure that we make everyone accountable for that. Those three transformations that we will be presenting at COP27. As you know, in 40 days from now, even less than 40 days, the world will again focus on climate change at the COP27 in Egypt, in Sharm el-Sheikh. What WHO, the World Health Organization, and I hope that together with WHO, the whole scientific and health community, what we will be presenting is what we call the health argument for climate action, telling people what will be the enormous health benefits that we can obtain if we tackle the causes of climate change. And one of the huge benefits will come from the fact that applying a Paris Treaty, I mean a climate change agreement, in fact, is already putting in place the One Health approach, because tackling the causes of climate change will require this multidisciplinary, multi-intersectorial collaboration, and more than anything, recognizing the environmental determinants of our health. These three transitions for which we need to be very much behind as health professionals, because we have the credibility, because we have the scientific evidence, are three. One is the transformation, the transition to clean sources of energy. We need to help to accelerate this transition to renewable, clean sources of energy. Today, we still have every year 7 million premature deaths caused by exposure to air pollution. And this air pollution is essentially caused by the same causes that are responsible for global warming, which means the combustion of fossil fuels. We need, and we have been documenting for many years, what is the negative impact of the combustion of fossil fuels in terms of polluting the air we breathe and responsible for those 7 million deaths, for all of those cases that are filling our hospitals, and our hospitals are paying the price of this lack of clean air that we are breathing. So if we accelerate this transition to clean, renewable sources of energy, we have already an important public health achievement, and as I say, putting in place this collaboration from a One Health perspective. The second transition is clearly the one on investing on sustainable food systems. Again, if you want to tackle the causes of climate change, you need to accelerate a more sustainable production of food. From the beginning, from the use of pesticides and fertilizers, to the end on the waste of the food that we are producing every year, with more than 30% of the food production ending into waste that then we need to manage. So if we accelerate this transition, and again, if we put in place the Paris Treaty, again, a public health treaty that will be implemented, because we will be able to have healthier diets and decreasing the terrible epidemic we have at the moment of obesity, with all the consequences for our health that this is causing. And the third transformation is very relevant for the discussion of today. And I know that my dear friend Carlos Dora, Dr. Carlos Dora, will be talking about that, is this urban transformation, a healthy urban planning that we need to do. And again, it's so much connected. The climate change agenda needs to look at the transit, the mobility in our cities, reducing the private use of cars, and promoting a sustainable collective transport system that will reduce pollution, that will reduce accidents and injuries, that will facilitate a more active life, and therefore reducing sedentary lifestyle and reducing the prevalence of non-communicable diseases. This healthy urban planning is very exciting, and where we need to work with mayors and urban planners. More and more health professionals, we need to interact with them, because they are kind of local ministers of health, our mayors. They have the possibility to work on different sectors of our society, from transport to energy efficiency in the buildings, from engaging the health sector. And let me finish then, in addition to these three transitions that we will be promoting at COP27, and I hope we will count on the support of all professionals and universities and academics and groups. In addition to that, we need to lead by example as health professionals. And therefore, in WHO, we have launched last year at the COP26, together with UK presidency, the initiative for decarbonizing the health system. And this is a very positive initiative that most of professionals are now embracing with a lot of enthusiasm, because it's very rewarding. We need to decrease the carbon footprint of our own health systems. At the moment, the health systems are contributing globally an estimation of between 5 and 7% of the global emissions of carbon. If we can reduce that, it's not that it's a big number, but we will be leading by example. We will make our hospitals and healthcare facilities more efficient, less pollutant, better use of the resources. We will decrease packaging, plastic use. We will improve our waste consumption and management. And all of that will generate a motivation as well for our health professionals. So with that, I will again call on all of you to get very much mobilized. I think this is a moment where, again, the health community needs to be very proactive, as we did many years ago on promoting access to safe water and sanitation. Now we need to make sure that the voice of the health professionals is heard, not only to treat the patients that are caused by bad practices on destroying our ecosystems, but as well for leading the change and the transitions that are needed. Again, I appreciate very much. Grazie mille per l'invito. Sono molto felice di stare con voi. And I count on all of you to raise the voice of the health professionals, to green the health sector, and to make sure that these transformations are occurring for our health. Thank you.